Hello, I am Dr. Ike Egbuna, a board-certified gastroenterologist with GastroCare of El Paso. I am here to talk to you about your colonoscopy. A colonoscopy is a procedure that we use to look at the large intestine, also called the large bowel or colon. Colonoscopy procedures have been around since the 1970s and is a safe, effective, and well-tolerated exam. There are about 14 million colonoscopies done in the U.S. each year. During the procedure, a colonoscope, which is a long, flexible tube with a small camera and a light on the end, is inserted. This allows the doctor to see the inside of your colon. Pictures are transferred from the colonoscope to a TV screen that your doctor watches to find abnormalities. While a colonoscopy is most commonly used to look for colon cancer, or more ideally polyps, which are small growths in the colon that can eventually turn into cancer, colonoscopy can also be used to evaluate and treat many other diseases like inflammatory bowel disease, hemorrhoids, and other disorders of the large intestine. Let's go back for a moment to colon cancer. Every individual has a 6% risk of developing colon cancer over his or her lifetime. Colonoscopy can prevent colon cancer by finding polyps and removing them before they can turn into cancer. It is the best test we have for screening for colon cancer and is the only test that can both find and remove polyps at the same time. In this video, you will learn more about what to expect before, during, and after colonoscopy. Before having a colonoscopy, you will receive instructions on what to do leading up to the colonoscopy well in advance of the procedure. These instructions will focus on what you may or may not need to do with medications you are currently taking and how to drink the bowel prep. You will be advised on the diet and the cleansing routine to follow before the procedure. Cleansing with the bowel prep begins the day before the exam. There are many different types of bowel preps. We typically try to prescribe a prep covered by your insurance. They all require a clear liquid diet for one entire day before the procedure. The laxatives are taken the evening or night before the procedure. You can carry out your regular activities the day before, but you will need your evening free to take the bowel prep. The bowel prep is the most important aspect of a colonoscopy. Following the instructions about diet and bowel prep can have a tremendous impact on your colonoscopy. A well-cleaned out colon is likely to result in a colonoscopy that is quicker, safer, more comfortable, and more effective. A proper bowel prep is very important so that your doctor can clearly see the colon and can identify polyps or other abnormalities. A poor bowel prep, where the doctor is unable to see the colon, may result in the procedure being canceled. Your doctor will also need to know what medications you are taking before your procedure. You may be asked to stop some of those medications before the exam. Medications like blood thinners and weight loss medications like Ozempic, Mounjaro, Trulicity, or Phentermine. Most colonoscopies are performed with the patient under sedation, which involves getting medication through the vein to make you sleepy. Colonoscopy is a very well-tolerated procedure, though you may feel some sensations during the exam and a little bit of gas and bloating afterwards. Most patients do not even know that the procedures happened when they wake up. Be sure to make arrangements in advance to take a day off from work and for someone to take you home after the exam. You will not be allowed to drive, and you may need assistance if taking public transportation because of the sedation you have received during the procedure. Also, it is not safe or advisable to go back to work the same day after the procedure. A colonoscopy typically lasts about 30 minutes. We will be looking for abnormalities such as bleeding, polyps, and cancer. It is not uncommon to find polyps. Approximately 15 to 40% of people undergoing colonoscopy to screen for colon cancer will have polyps. Polyps are important because the majority of colon cancers develop from colon polyps. Most polyps are benign, meaning they are not cancerous. However, these polyps have the potential in some cases to turn into cancer, so it is best to have them removed. Colonoscopy removes polyps before they can ever become cancer. After your procedure, you will be closely watched for about 30 minutes. You will be allowed to have something to drink immediately following the procedure, and you can generally resume your normal diet. Someone from the team performing your colonoscopy will speak with you before you leave, and will go over the results of the test, as well as any medication changes and the follow-up plan. Before you leave, you will know at least some preliminary results of your exam. It is quite common to have tissue removed during the test, which is called a biopsy. This does not necessarily mean that anything is wrong. Any tissue removed will be sent to a doctor called the pathologist for them to look at under the microscope. These results will not generally be ready right away, and they take several days to be completed. You can usually return to normal activities the next day after the procedure. Unexpected events or complications are very rare, but they may occur. Complications of colonoscopy may include missing a lesion, injury to the colon wall, such as a tear in the lining of the colon, which is called a perforation, bleeding, or having a bad reaction to the medication used for sedation. These are, however, quite rare. For example, perforations occur in less than 0.2% of screening colonoscopies. This video is a description of the important aspects of your colonoscopy procedure. If you have any additional questions, please reach out to staff at GastroCare of El Paso, and we will be happy to address any concerns.